This video is it's a lesson that evolution has created the perfect injection device and then put it in a small four-legged animal that many humans call whiskers. Hey there, fellow mortals. It's Ken again, and this is another FTP Fast Track from the Pit Fast Track. I know it's been a while. I'm going to be talking to you about bite wounds, in particular animal bite wounds, in particular cat bite wounds. And the reason what prompted me to think of this was someone close to me was recently bit by a cat, and they called, and they were primarily worried about rabies, which with pets like this, it's usually not so much a concern, but with any bites, the big concern becomes bacteria in the mouth. And this is not to say that dog bites aren't a concern, not to say that human bites aren't a concern or other animal bites aren't a concern when it comes to mouth bacteria, but from experience, cat bites are the worst. The worst, even when they're properly treated and put on antibiotics reasonably fast. The skin infections can develop very quickly, and they can be very bad to the point where they need IV antibiotics and sometimes a hospital stay. The bacteria in question that's in the mouth is called Pasteurella multicida. And the thing is, and what I was alluding to in the opening of this, is that cats' teeth, they're basically tiny needles. And when they bite you, they push the bacteria deep into the skin. And when the tooth comes out, there's not much of a wound there. And it's nearly impossible to irrigate that and get that properly cleaned out, even in the ER where we do things. So, I mean, you still try to clean it out, but the key is getting on antibiotics as soon as possible. And if anyone knows me, I'm big on antibiotic stewardship, and I don't hand them out like candy. In most cases, people don't need them, but this is one of those cases where people need them, because even when you are on them, there's still a high risk of infection setting in. And again, it's not like other animal bites can't be a concern or other bites can't be a concern, but the thing about dog bites is, dog bites tend to tear more than puncture. So wounds tend to be more open, and we can actually irrigate them out pretty well. So, we don't see the skin infections develop as much as we do cat bites. Human bites can do it, and particularly, if when somebody punches a guy in the mouth and they catch the tooth, we call it a fight bite over the knuckle. Those can be really bad. But really, overall, cat bites can be some of the worst bites out there. So, it's one of those things where if you're bit by a cat, you need to be seen immediately. And I know it might not seem like a lot, but in most cases, I recommend just, unless you can get into your doctor that day, and particularly if it's like in the middle of the night, as it happened with the person I know, I would get to the ER and get started on the antibiotics as quickly as possible. Because if you wait too long, you're really inviting a bad infection to set in. And even being on the antibiotics, you really still need to keep a close eye out for an infection developing. As far as rabies, as I kind of alluded to earlier, pets for the most part, dogs, cats who have their shots up to date, or even if their shots aren't up to date, but they can be watched for 10 days. In most cases, rabies shots aren't recommended. It's really when they're a stray. If it's a stray dog, a stray cat, or any stray animal, you definitely need rabies in that scenario. So pretty much any bite wound, get seen immediately. Talk to the healthcare provider, not just about antibiotics, but have them assess the need for rabies or not. And don't wait on it. And that's basically it. Not much else to say. So thanks for your time as always. Remember, take care of yourself, take care of your crew, and I'll see you back in the pit.